Hello and welcome. I'm Alex Churchill. I come from the Department of Health and Social Care. I sit within the Chief Scientific Advisors area within DHSC, and we're responsible for funding, public funding of research into health and care. In particular, I'm responsible for clinical trials and central policy on how we improve clinical trials in the UK, supporting Ministers, Secretary of State Wes Streeting on this. So I'm really delighted to come here today for the launch of this NHS Private Mental Health Research Partnership. I've got a few words and then we'll hand over to Toby. And there's quite an agenda. Hopefully everyone's got the agenda. There's some keynotes as well as a panel discussion. So I think it's going to be really interesting. But to start with, I want to say how pleased I am to come here and be part of this launch, because I think it really demonstrates how this, particularly for this, it's aligned to the government's priorities on supporting brain and mental health research, and in particular doing it in partnerships. It's a shining example of how we're integrating private and public funding to bring new research and innovation to the health and care system. And it really aligns with the government's mission as part of the 10-year health plan and what we're doing. And I'm very pleased to come to Doncaster about that. But while it all seems obvious that this is important and making brain and mental health research more accessible to people, embedding research into health and care settings, as you're doing, is exactly what we need in the system as a whole. And it, as I say, it aligns to the 10-year health plan as well as the industrial strategies life science sector plan. But why is it important? Embedding health and care research is essential to improving our population's health and well-being. And we really do need to give it a higher priority in health and care settings, as we're seeing here. First of all, it really, by proactively integrating research, it not only improves people's health and well-being, but it also promotes economic growth. And I just want to pull out a few figures of why it's important. So I represent the sort of public funding of health and care research through the National Institute of Health and Care Research. That really generates some real returns on investment. So, for example, for every £1 we spend to the NIHR, we see a return of about £13 over the next 60 years, which is an incredible return on investment. And that really sort of drives economic benefits. It generates jobs, it generates wealth, which in itself goes to support and help us provide a healthcare system. Growth is important, and I'm from the government, so I have to say that we've got to focus on growth. But why is it important? It really is important for patients, and we know that if we embed research as part of healthcare, we see patient benefits and better health outcomes. For example, the research active NHS trusts have 5% lower mortality odds. We've measured that. So you get real benefits, and you get access to new treatments and new interventions for people that participate in those trials, which generates better outcomes, health outcomes. And it's estimated, for example, for those research active hospitals, that they reduce about 3 million sick days a year through that kind of research. So it's really critical. And some of this is about acute illnesses, but we're here today looking at mental health. We know that mental health is a real driver to and impacts people really badly, and it doesn't allow them to work and enjoy their lives properly. So it's really important. But more important, just as important as patient benefit, and I want to really lay on that's the most important. There are other benefits from why embedding research is so important. We see that research active trusts have better staff retention, with 67% of doctors are more likely to apply for research active roles, and 92% of doctors and 88% of nurses surveyed want research as part of their role. So it generates a better workforce as well as a better health outcomes. So just a few more things, and I've got limited time, and I'll hand over to Toby very quickly. But embedding research then into our health and care system is vitally important. In terms of industrial clinical trials and commercial clinical trials, which, in Clerkenwell here will helpfully deliver that, we see that there's an added benefit to the economy of about £7.4 billion a year through commercial clinical trials, and that creates 65,000 jobs. Of that, 1.2 billion gets invested in the NHS. That means that we've got 1.2 billion of public funding that can go out for other things, other healthcare, and provide care to other patients. So it's vitally important. What are we doing in terms of the Department of Health and Social Care? There's a tremendous focus on how we make the UK competitive for clinical trials. Clinical trials is an international market. Companies take their trials all over the globe, and we want to make sure the UK is really competitive. So we've set up something called the UK Clinical Research Delivery Programme, and our initial focus has been on how we really set things in train and support trusts and research centres to speed up the setup of clinical trials and speed up the time to first participant, which is what industry say that they really want. That said, we're still seeing that for the third year in a row, England have recruited increased number of first global participants in trials and first European participants in trials. So we are still competitive, but we need to do better on that. So I think looking ahead, I think this is a tremendous partnership. It really supports what we want as part of government in terms of the policies we're setting out, both in the 10-year health plan, but also the life science sector plan, and indeed sort of supports the Prime Minister's commitment to really make sure that we are internationally competitive for clinical trials. So on behalf of the Department of Health and Social Care, first of all, thank you for inviting me. I really wish this partnership full success and best wishes and good luck going forward. And with that, I'll hand over to Toby. Thank you.
Hello, everybody. I'm Toby Lewis. I have the huge privilege of being Chief Executive of this NHS organisation. You can tell you're in an NHS enterprise because we organised a queue to get into the room, then a queue to have a cup of coffee, and we haven't quite provided enough chairs. But welcome to a public-private partnership through which we will, among other things, learn to get beyond that. You're sitting here in a place called Flourish. Okay, so this building, as you'll have seen on the various signs, is Flourish. So let me start by saying what Flourish is. Flourish is a community interest company that is a partnership with RDaSH. You'll see the connection to why we're here, if you see what I mean. So this organisation was set up some time ago in order to develop vocational training for people in our communities, partly through the grounds and gardens that rather elegantly sit around the house. And they're relevant to our conversation today because they testify to a long-term tradition at RDaSH of trying to create different alliances and different relationships that aren't entirely NHS usual. And so it's significant that Heather and her team have chosen to base us for the launch today in this particular place. You are also welcome to England's newest city, Doncaster. If the mayor were with us today, and I know she's been involved in this project over the last few weeks, she would want to point out that in due course you'll be able to arrive by airport or by airplane at the airport, which for those of you who've struggled through the tube strike in London this morning is probably a good thing. So Doncaster represents a real opportunity for Yorkshire and Humber and the wider North Lincolnshire to bring people together. There is a thriving digital and AI sector in the city. There is an emergent educational landscape. And then through partnerships like the ones that Tom and George will say more about later, we're trying to make sure that we have the right mix of industry in our midst. And the NHS, as a relatively wealthy contributor to the city, I get that the staff who are here from the NHS might think, I'm sure he always talks about how poor we are, but a relatively wealthy contributor to the city needs to lean into that conversation and play its part. So you're welcome. But many of you are researchers. So in 5 years' time, you will come back to this place, I hope, and we can look back on whether we've achieved anything together, because that's what decent science would provide for. And I'm hoping, and it follows from what Dr. Churchill was saying, that what we find in a few years' time is, yes, that colleagues from Clerkenwell have brought startup energy, enthusiasm, intellectual calibre, investment, and so on to this collaboration. And the NHS has lent its blue lozenge and has brought all of the smarts that our clinicians can bring to a collaboration of this nature, providing we actually create the time for you to do that, and the space for you to do that, and the headspace for you to do that. But what holds back research isn't the ideas, is it? It's the translation of those initial research ideas into practice. And RDaSH is well positioned to contribute to that conundrum, which I would suggest is a national conundrum, of how we translate proven constructs into something that lasts a little longer. Because, and it's fantastic to see GP colleagues with us today, we as a neighbourhood-led organisation, and I appreciate that's now a slogan, but it is actually the journey we've been on for a wee while as RDaSH, we ought to offer the opportunity to think about how good ideas generated through this partnership, proven through this collaboration, can in practice flow out into the mainstream of what clinical practice is in this part of South Yorkshire. So that's my, in 5 years, aspiration for what we might achieve together. In the 1 minute I've got left, let me make 2 more points. You would have come today expecting that people at the front with the wobbly lectern would have talked about health and wealth. And it is entirely and clearly the case that health is potentially an economic engine, and that we live in a country in desperate need over 30 years of a little more growth. We've come to a place that is marked by significant poverty. The communities in which we live and work have lived through deindustrialisation and all the rest. But the opposite of poverty isn't wealth. The opposite of poverty is justice. And justice in this space where we are today is about tackling the lack of parity of esteem that comes with mental health and comes with mental health conditions. And that's why the board and governors of RDaSH are proud to be part of this partnership. And what better person to provide much more of a sense of that than my colleague Akeela Mohammed, who speaks next. Thank you.
I'm not Akeela Mohammed. She is speaking next. I am George McBride. I'm one of the co-founders at Clerkenwell Health. I just wanted to do some of the boring bits. I'm going to be emceeing this event today, so I just wanted to thank you all for coming, braving public transport and everything else to make it here. Sad to see that a few people have been unable to make it due to travel issues, and I wanted to also think about some of the people who couldn't be here. I know Mehul and Bridie were a big part in getting this partnership set up. Mehul we've had to send to Boston, and Bridie's gone off and building her own new business in clinical research, which I'm sure will be a great success. But I wanted to say, if there is a fire alarm, there are no test fire alarms scheduled today, so please do make your way out in an orderly fashion. The meeting point is just outside here, so I'm sure people will help signpost you in the event of a fire, which we hope won't happen. We've got a panel to look forward to, but I will get off the stage and let the speakers talk first. So we've got Akeela Mohammed to speak next before our Clerkenwell CEO, Tom. So Akeela, welcome and thank you for coming to give a talk.
Thank you, and thank you for inviting me. Thank you, Toby. Okay, so good morning. In 2017, my husband, aged 48, took his own life. That loss made me ask a difficult question. what research was actually happening around mental health in my community and were our voices even being heard. What I discovered was a gap. Research and health initiatives often happened around us, not with us. The realisation set me on this path, and that's why Healthy Her, my ladies group, has become so important. Healthy Her began as a space for women to come together through sport and then a social group. Over time, it grew into a trusted environment where women felt safe enough to talk about things rarely spoken about in our community. Mental health, menopause, depression, and suicide. That trust is why we were able to take part in the NIH Research Ready Communities, which actually started here. We did it here. My group didn't just turn up to research. They joined webinars, gave feedback, and even acted as peer researchers themselves. For women who had often been excluded from health opportunities, this was transformational. This is why research and health organisations must reach out. Communities hold knowledge and lived experience, and no statistic can capture that. But to unlock it, there has to be trust. And trust means involving communities from the very beginning, keeping people informed throughout, showing them what happens as a result. When that happens, communities don't just participate, they lead. Our women now want to be part of research and in the future, and not just as participants, but as partners. Imagine the difference if every health organisation worked this way. Research could no longer feel like something done to communities, but something done with them. More inclusive, more effective, and more trusted. So my message is simple. Reaching out to communities isn't optional, it's essential. With trust and genuine partnership, communities move from being underserved to being right at the heart of research. Thank you.
Hello, everybody. And again, I'll just reiterate the thanks for everyone braving the trains, tubes, and everything else to get up here today. Before we dive in, I just wanted to sort of say from a kind of personal standpoint, this really is a huge career highlight for me personally and for Clerkenwell as a whole. It's an incredibly unique partnership that we've built over the past year, and really, really excited to tell you a little bit more about it. Before I dive in, I'd just like to say a special thanks to Alex and the Business Doncaster team who made the initial introduction here and have supported us throughout, and equally to the RDaSH team. So without Toby's buy-in at the beginning and Heather's support throughout all of this, as well as all of the other functions who've chipped in, so pharmacy, estates, the doctors, etc., who've all been, so supportive of this throughout. So I'd just like to say a huge thank you to you guys as well. We've pulled together, I was totting up, probably 50 or 60 different individual contributors to get us here, both from Clerkenwell, RDaSH, and from security designers, builders. So it's a massive deal, and it's not been easy, but we're now finally at the point where we're ready to launch these studies. So why are we here today? I think there are sort of two data points that I thought were quite interesting. As you'll have seen, Clerkenwell Health, we are a specialist research organisation focusing on psychiatry and neuro. And we opened our first research unit in London in 2023. And that year, in England alone, there were 8.9 million people prescribed an antidepressant. It's a huge, staggering number, because when you think about that as a percentage of the population, you're looking somewhere between 50 and 20% of the adults in England. And often those antidepressants, these are old medications. You're seeing maybe 20 or 30% of people will not respond to them at all. And another 20, 30% are maybe responding, but with awful side effects. So I think there is an urgent unmet need, not just here in England and the UK, but on a global scale. But that brings me on to this second data point, because I was scrabbling around yesterday trying to identify in the last 10 years, how many drugs, new chemical entities, have actually been brought to market in psychiatry? And I could only find 8. And that's across, addictions, depression, anxiety, you name it. It's a terrible state of affairs. Particularly when you look at something like oncology, which again in Europe in the last 10 years, I saw that it's been 55 new chemicals come into market. And it's that disparity really that Clerkenwell is really trying to solve, and I really hope this partnership is going to do a hell of a lot to accelerate as well. So I'll just take a moment to give you a little bit of context on Clerkenwell Health. So we have been up and running now for 5 years. All of the founding team are here, my long-suffering partners. They've seen George, there's Sam over there, and Henry here as well. Please do come and corner them and ask any questions you might like as the day progresses. But we were drawn together with an interest and a fascination in particularly psychedelics and what these treatments might offer for people with psychiatric conditions. Because they're such unusual or complex treatment modalities, we thought that they needed a real specialist partner. When biotechs or pharma companies are looking to bring them to market, they need a specialist who understands the nuances of the patient population, but also how these drugs need to be administered. And that's what we set out to build. So first couple of years, Henry in particular did some great work supporting biotechs with the design and getting these studies approved by the MHRA. But during that period, we also identified that the real gap, not just here in the UK, but almost globally, is that studies are consistently falling down because there is a lack of infrastructure specialised to identify the patients, provide an incredible experience for those patients from the very first moment you're reaching out all the way through so they don't disengage, and then making sure that you've got the facilities and the right kind of people to ensure that these studies are delivered at the pace that sponsors need. So we opened our first site in London just over 2 years ago now. We've worked on 8 or 9 different clinical trials there now, predominantly in psychedelics, but although we're starting to pick up work now with more traditional pharmaceuticals as well. That's been incredible, but what we've always driven to do with Clerkenwell is increase patient access to these treatments. And this partnership with the NHS is a huge, huge milestone for us because obviously it's one of the biggest healthcare organisations in the world. And, you know, the communities and the access to the patient groups, etc., that this group have here is going to really rocket fuel the ability for us to drive these studies through at the pace they need to. Our ambition for Clerkenwell over the next year or two is to take this template and open another 2, maybe 3 sites in partnership with the NHS over the next couple of years. To go back to the original point, the UK has slipped in terms of its standing globally, particularly in psychiatry research, but 4 to 5 plus sites in a market is what we're consistently being told by the drug developers and by the CROs is the magic number for them to say that, yes, the UK is a place we want to do this research. And we're already starting to pull some sponsors back off of the performance in our London facility. So really looking to sort of turbocharge that here. So onto the partnership. It all started a year ago, as I say. We were introduced to Heather through Alex and Business Doncaster. And the idea was relatively simple. It's been touched on already by Toby, but how do we bring the best of both worlds? Us as a commercial operator who was going out, young, scrappy startup, but building a really good name in terms of our delivery capabilities with what the NHS and RDaSH in particular do great, but they've got a stunning pool of talent, doctors, nurses, researchers. But as I say, that deep understanding of the local communities and the patient populations as well. So we've tried to sort of pull those together and just give you a sense of what this model or this partnership actually looks like. The team here were fantastic. So I'm keep looking over there because the site that you're all going to go and see in a moment is down there. So they identified a bungalow where we could set up our operations. We used some of the designers and specialists that we know to design that in a way that we think is perfect for psychiatry and neurological patients. Comforting, it's going to look very different to maybe a traditional hospital ward, I think. And essentially, yeah, obviously there'll be, some rental fees coming back to the NHS that way. But additionally, we're looking to augment that by using some existing services here. So the pharmacy, the labs, and then really collaborating on how we engage the local community and encourage people to sign up to these studies as well. And I think it's going to bring a myriad of benefits. These have already been touched on a little bit, but obviously we're going to broaden the access to some seriously cutting-edge treatments for patients in the local area. We've seen some astounding results in the studies we've run, where you're seeing anything between 50 and 70% of the patients with very hard to treat conditions essentially looking like they're remission 3 months after a dose or a couple of doses of some of these compounds. So it really could be the future of mental health care. And I think providing the clinicians here with access and an understanding of how they work before they're actually approved, I think is hopefully another major benefit to RDaSH as well. And then for us, obviously, the obvious thing is we're entering a brand new region, braving it outside of the London bubble. We're getting access to all of the amazing experts in the room and beyond as well. And ultimately allowing us to service a whole new category of patients in the UK. So hopefully RDaSH feel the same, but for us, it's been a true kind of win-win, this partnership. And it's allowed us to create a template, really, that we've now gone out and started engaging other NHS trusts across the UK with. And the trust that we've built, I think, with the RDaSH team is something that's really landing well. So I think the next time we look to do this at another facility, whether that's in the Northwest, West or elsewhere, it's going to be a hell of a lot easier. So thank you very much to the team here for doing all of the hard work with us. You've been incredible. I think we've really enjoyed it and can't wait to get the first studies up and running. Thank you.